I got the chance to travel alongside a midwife. And here's what really stood out. We often hear that midwives only take on low risk pregnancies, but that got me wondering what actually defines high risk? Is there a set list of what midwives can and can't do? Turns out it's not so clear cut.
The way I think about each woman is individually. Collaboration and co-management is a big thing for me. I think about every single client whenever I do a consult, every single one, I really dive into their history and make sure, especially if they do have things that are what some would consider a little more high risk. I really do a deep dive on all of it, just to see where are we. If it's somebody that has had diabetes their entire life, and they're completely managed and completely controlled, and they are following up with their endocrinologist, and we're going to collaborate with multiple different providers and make sure that everything is safe.
One midwife might be trained to handle a breech birth, while others might not. And in Olivia's case, where many might churn away a diabetic mom, Olivia is prepared, carefully monitoring glucose, watching both mom and baby every step of the way. It's about personalized care, close attention, and doing what's safest, not just by the book, but by the individual. So here's my biggest takeaway. The line between low risk and high risk isn't set in stone. It really depends on the midwife, her training, her comfort level, and what she's equipped to handle. Midwifery isn't one size fits all. It's relationship based, wisdom guided, and deeply personal.